So starting off, what is low value care? There is some distinction between different definitions and terms that people use commonly when we talk about overuse or waste. And they're often used interchangeably, and they for most purposes, can be. Waste typically captures all different types of inefficiencies in the healthcare system, like administrative waste, which would capture complexity of the healthcare system in general, or operating waste, which would capture duplicative services or other things. Our focus today and with VBID Health and our low value care efforts is primarily on clinical waste. And we are foremost concerned with two specific types of clinical waste. One being medical care that is harmful or where the harms outweigh the benefits. And a potential example of this, and we'll go into more detail later, would be something like a prostate-specific antigen screening for men over 70, broadly understood by both the U.S. Preventive Services Task Force and clinical communities to have more harms than benefits, especially at that age, and can result in a variety of cascading harms that clearly outweigh the benefits. There's a second type of clinical waste, medical care waste, called that we refer to as care that offers no benefit over less costly alternatives. And an example of this would be using branded drugs when a chemically identical generic is available, which is more of a resource allocation problem than harmful. But you're not buying any additional health per dollar. So low value care, the term sort of captures the clinical nuance, more so perhaps than the clinical waste. And it recognizes that services differ in value depending on patient, provider, when it's received, and so on. So we like to use the term clinical waste, or I'm sorry, low value care. But why address waste at all? First, it's the magnitude of the situation. There is a large amount of potentially wasted resources based on current research that could be used for better things. For example, in 2012, there was an analysis that up to 34% of spending on healthcare is wasted. This includes administrative waste and this operating waste that I talked about before, but clinical waste is certainly a part of that. And then there's also 21%, there was a physician survey that estimated about 21% of care that's used is unneeded, which in terms of utilization is a lot. But in terms of dollars, we see that estimates vary significantly, but there is upwards of $765 billion a year spent on low-value care is a particularly large problem and is a resource allocation crisis. The bottom line, even though the estimates vary, the bottom line is that it's pervasive and costly. And we also just don't really know the true extent of how much we spend on low-value care. There's a cascading downstream harm and medical costs and out-of-pocket costs associated with low-value care that we don't actually know, and there hasn't been a systematic effort to measure it. And that's one thing that we will address today. So at the core of this, there is first the financial magnitude and burden, but there's also at the core this harm to patients. There's a financial and also ethical urgency to address low-value care. It's pervasive, it's costly, and it's also harmful. There's the direct physical harm associated with services that are low value. These services often either cause harm or they might have incidental findings that create worry and harm in the future. There's cascading downstream harm and costs related to these incidental findings or other situations related to low value care. There's the opportunity cost, the botherness, and the exacerbation of health disparities that come from low value care. There have been studies that that show that racial minorities in particular are more likely to receive low value care. And out-of-pocket costs. Patients end up paying out-of-pocket for care that doesn't buy them additional health, which is a problem. And sort of one of the reasons I bring this up, the harm specifically, is that when, in terms of communication at least, harm to patients is very salient. There's been research to show that focusing on harm is one way to communicate low-value care in a way that is meaningful and can move the ball forward.